Hello, and thank you for joining Conversations with Barbara. With me today is Dr. Robert Reece to talk about his book, Strong Medicine. Welcome to the program, Dr. Reece.
Thank you, Barbara, very much.
Yes, I want to start by thanking you for writing Strong Medicine. It's not only a very interesting, a great story and an engaging read, but you have opened my eyes to some of the really questionable practices of many drug companies. I just, every time I see an ad on television for a new drug, I think of your book, and I'm much more critical than I was before. So I wonder if we should tell viewers just a brief summary of Strong Medicine without giving away too much.
Sure, I'd be glad to. Protagonist is Dr. Tom Barrett, and he has come into a great deal of money because of a lawsuit against the pharmaceutical company that did damage to him in my last book, Double Blind, Double Cross. So he decides that he's going to set up a watchdog agency that he calls Pharma Truth. And the object of this Pharma Truth and nonprofit is to collect information from real patients who have suffered at the hands of bad practices of the pharmaceutical industry. So he goes about this, and in the course of the book, he recruits a couple of medical students who actually come to him, having seen his website, interested in helping with this project. And he makes them the emissaries for the Pharma Truth people to come out and talk to the people who have indicated their displeasure on the website. So that's how the book starts out, and it then moves into the more active phase where the various members of Pharma Truth get in touch with congressional individuals and bring about some legislative hearings about what should be done about these bad practices in the pharmaceutical industry.
Yeah, and those practices are very evident today too. It seems that your book is so relevant. In the real world, we haven't seen Congress rein them in. Can you? I think it would be interesting to get your opinion of say what was at the root of for example, the opioid crisis.
Well, the opioid crisis has been well documented both in the press and through the various lawsuits that have been brought against the pharmaceutical company, particularly Purdue, who were complicit in pushing the drugs into a state of addiction, knowing full well, and this is proven by the Attorney General, Maura Healey, brought suit against Purdue, and in her lawsuit, which I've read with great interest, she gives chapter and verse of what went on through the emails and the recordings of the board meetings and so on of the Purdue Pharmaceutical, and it was clear that they were pushing their drug salesmen to get out there and push the drug, and never mind the addiction issue, they pushed it and pushed it and pushed it, and what resulted was a tremendously disastrous and horrible outcome for an awful lot of people in this country. And we're still fighting the opioid crisis. And this was really one of the more egregious acts of pharmaceutical companies, Purdue being the principal one, but there were others as well. And it was all in the pursuit of the almighty dollar.
Exactly, greed. And in your book, one of your characters, without her even knowing it, discovers that she's been addicted just because her doctor gave her a too generous supply of OxyContin. And speaking of complicity, you do in your book, there are some doctors who have also been, shall we say, complicit in in spreading the use of drugs.
Yes, well, I think this is true, and fortunately, there are a few doctors that have been involved in this. I'm hoping there are a few. I'm not aware of numbers when it comes to this, but there are documented cases of doctors who have been recruited by the pharmaceutical industry to become what we call key opinion leaders within their profession. And they involve other doctors through conferences and lectures and that sort of thing to prescribe various kinds of preferred drugs preferred by the drug industry that makes them. And they have been involved in quite a few of these kinds of things where the doctors are invited and are given dinners and other kinds of inducements to come and listen to the lecturers who are paid by the pharmaceutical companies to provide quote unquote educational information about these drugs. And then the other problem I see with, and I had this experience personally when I was in practice, that detail men and women, these are the people who are representatives of the drug houses, come to your office and give you lots of samples and all kinds of compliments and a lot of misinformation about the drugs that they're trying to push. And they also have been going to hospitals and various other kinds of healthcare facilities, and they give lunches and dinners and free meals and all kinds of inducements for people to come, the healthcare providers to come and enjoy lunch or dinner while they make a pitch for the drugs that they're trying to sell.
You would think that doctors would know better, but in your book you have it's a kind of explanation, a sort of analogy. The frog and the water. Do you remember writing that?
The scorpion and the frog.
No, the why doctor.
I know what you mean.
I'm used to
the frog who is put into a cold water container and gradually is heated and becomes completely unconscious as the heat rises. Whereas if you put a frog into a real hot boiling water, they'll jump right out. But because of the gradual nature of the heating, the frog is sort of lulled into a false sense of security.
Yes, that struck me as such a good analogy for why we have so much white collar crime too. It is also, doctors and corporate executives get used to it, and then I guess everybody's doing it, so why shouldn't I do it too? And
yes,
then
I think that's what operates. Unfortunately, greed is not an exclusive right of anyone. Anyone
Exactly.
can be induced into getting greedy, and when money is dangled in front of one's face, it's very hard to resist. And
Exactly.
ethical constraints need to be applied when this kind of thing is happening.
Yes, yes. I think you have some concerns too about currently what's happening. I think with some new drugs, particularly having to do with Alzheimer's.
Yes, I didn't address this in the book because it hadn't come up at the time. We knew that there were a lot of companies researching drugs for Alzheimer's disease, which is a terrible, terrible malady that is affecting millions of people in this country, and for which everyone is looking for some kind of help, some kind of treatment that will be of help. The latest thing is Biogen has put out the drug Aduhelm, and it got a very rapid review by the Federal Drug Administration, and it got approved despite the fact that numerous neuroscientists on their advisory board advised against approving it because of the poor performance of the drug trials. They were not very convincing to these individuals, but for some reason there was what they called a back channel approval that went on with a particular individual within the FDA, and the FDA approved this drug for general use. And it's, first of all, the studies only showed that it was possibly effective in milder cases, and it wasn't even very convincing that these cases were helped by the drug at all. This is a very difficult area of research, and it's not easy to get your endpoints properly aligned. So, but the FDA approved this, and now it's on the market and is it's something like $5,000 per year for the treatment for this, and that a lot of the insurance companies are balking. I think the Veterans Administration has already said no, that they won't cover this, and I think other insurance companies are wise to this and are backing off the covering of it. But this is one of the things that is so disturbing about this is a federal agency that is there to protect consumers against the rolling out of a drug that is unproven for its uses, and there they are approving it when their own advisors were telling it shouldn't be done.
Yes, and so you kind of wonder what has happened to the concept of do no harm. I suppose the need for some you can imagine millions of people who are suffering a drug that will aid them would be just a miracle, but they really need to be thoroughly tested. And I understand that there are side effects that.
Well, yes, of course, all drugs have potential side effects. I think I even sent you a cartoon that showed a doctor sitting at his desk, and it says, ask your doctor if a drug that was being advertised with 32 pages of possible adverse side effects is right for you. And this is the sort of, it's a joke when you see it in that context, but there's so much advertising on television about drugs. First of all, it seldom tells you what the drug is for. It doesn't ever give the price of the drug. And it always ends by saying, ask your doctor. And many times when patients ask their doctors about particular drugs, they are not thoroughly aware of all the side effects of the drug. And so asking the doctor is not necessarily the way to go. And this gets put into the patient's head as they watch television and see these deliriously happy people after they've taken this drug. And they want to get better from whatever it is that they're bothered with. And so they're desperate for an answer. They want the magic wand to be cast over their heads.
Yeah. Every time I see one of those ads, I think of strong medicine, and I realize that they are greatly oversimplifications. But what's really I loved about strong medicine too is that the citizen action worked, and so I wonder in the real world what can an individual do, or what should an individual, apart from being critically aware of these the issues you bring out in your book. Are there any actions that we can take that will rein in these drug companies?
Well, in the book, the prescription for doing something about these abuses is spelled out in pretty definite terms. And the action that needs to be taken is that the people who are offended by all of this or cannot get their drugs, have no access, can't afford them, should get in touch with their representatives and their congresspeople and their senators and complain and say, we have to do something about this, because this is something that will not be stopped voluntarily, because as long as there's money to be made, the drug houses are going to continue to do the same things that they've been doing for years. And I think the citizens lobbies need to be formed, and they need to knock on the doors of their congressmen and so on. Now, this is complicated by the fact that right now we're in the COVID epidemic, which makes the pharmaceutical industry look pretty good, because they have done a magnificent job of getting the vaccines out and delivered. But this is only one part of the pharmaceutical industry, and there are so many other diseases that need to be addressed and need to be addressed by medication. And it needs to be approved medication by the FDA, and it needs to be within reach of the people who need the medication. Sometimes it's for survival. One of the episodes in the book is about a woman with diabetes, and the cost of insulin has skyrocketed over the past several years. And this is a young woman, she's in her 30s, who has been a diabetic since she was 12, and has had insulin given to her and has survived because of insulin. But she said that the cost of their insulin has gone completely through the roof, and she is fully employed and can afford it. But she says there's an awful lot of people that she knew that could not afford the increasing price. And another example of this was the Epipen scandal a few years ago. Epipen being the drug that people who were allergic to bee stings and hornet stings they have to have this, because they'll die if they don't get epinephrine. So these things are life-saving, and if they're not basically life-saving, there are certainly things that need to be given on a regular basis to combat hypertension and heart disease and gastrointestinal disease, all of these kinds of things that people are suffering from. And they can't be denied these things because of cost. They just have to be brought back into some sort of sane management. And the other problem is there are a lot of generics out there that the drug houses are blocking, because if the generics get a foothold, the cost of the drug, the name drugs, will have to go down. And the reason the generics are being blocked is that some drug houses will take a particular drug that is popular and well ensconced in the armamentarium of most physicians, and every once in a while they'll make a little modification of the drug and then apply for a new patent and extend the patent for a number of years more than because it was beginning to run out. And this is called evergreening. It's well understood in the industry that you have to watch out when your patent is about to run out. You have to do something to make the drug you're selling last longer in a patented form.
So that small improvement that doesn't change the drug makes the generic not available. Is that right?
What it does is it extends, that's right, it makes it not available by virtue of the extension of the patent on the drug, which hasn't changed that much, but it's a slightly different molecule.
And generics are just as effective most of the time as the drug, and are much cheaper.
Yes.
I look for some complicated answer to why this goes on, and I guess it's just simply greed.
I'm afraid that's true. It's just the profit motive. It's capitalism gone amok. I'm a great believer in capitalism, but I think there has to be some restraint by the people who were running the drug houses. Otherwise, people are going to suffer and die as a result of the inaccessibility of drugs that they need for
Exactly.
everyday life.
Exactly. And we know that we have not made a great investment in public health, which is mostly at private, and there are lots of criticisms of our health system compared to other countries. Do you see that? We are failing in many ways.
Oh, yes. Well, when you consider that the healthcare industry is about 20% of our gross domestic product, 20%, that's 1/5 of the gross domestic product. That is a huge thing. And we have the most expensive healthcare system in the world, and we don't have the best outcomes in the world. Our infant mortality rate and so on are all below an awful lot of other countries. So it's a complicated issue, as you suggest, but it's got to be addressed, I think, by government. We have to have new arrangements with the pharmaceutical industry. With Medicare, for example, needs to be able to negotiate. Right now, they can't even negotiate prices of drugs. They have to pay whatever the drug companies set for the drugs that they have. We need to be able to negotiate. The government needs to be able to negotiate with the pharmaceutical industry. We need to be able to import drugs from other countries that are cheaper. I mean, if you go to Canada, you can get the same drug in Canada that we pay sometimes 4 or 5 times higher prices for, and there's no reason why we shouldn't be able to import them.
Okay.
And one of the reasons that the drug costs are so high in this country is because of the tremendous cost of advertising. When you look at television, it's amazing how many ads there are for the pharmaceutical agents, and it's got to cost a lot of money.
Yes. And yet the statement is that drug companies need all that money to put into research, whereas what you're saying is the advertising, not the research, that's eating up all that.
Well, I don't know the intern, and all pharmaceuticals are different. Companies are different, so their advertising costs are going to vary depending on which one they are. But the ones we see on television are repetitive and uninformative,
yes,
and annoying, really.
Yeah,
and they've got to cost a lot of money, and that causes the drug price to go up.
Yes, well, much work ahead, and I think what you say is so important. We should write our representatives, complain, and it's only when there's a public outcry strong enough can any of this change. I think your character organizes the media to support, and there are. So I think this is a public outcry with enough people complaining, and with the sorts of stories that you tell in Strong Medicine about people who suffer. I think it might be interesting for viewers to know something about you. You live in Falmouth, and you were a pediatrician here in Falmouth for many years.
Well, for about 10 years in the 80s, I was here as a part-time pediatrician. I had a wonderful partner in Barbara Lowe, who is now also retired, and Maura Shea, unfortunately died a few months ago. I was also working at the Boston City Hospital. My other half of my time was up in Boston. And I was doing child abuse detection and treatment at the other site. And that's what my background really has been in, child abuse diagnosis and management. And
and let's mention, with respect to the child abuse, your first book, which was your first book.
Yes, To Tell the Truth. Yeah.
Wonderful, very engaging story. I left that realizing that we need some legal reform yes, and that's still available. Can these books be found on Amazon?
Yes, they can. And Eight Cousins has Strong Medicine, and they can order the other books as well. I have to say that the Amazon arrangement has both paperback, electronic version, as well as now an Audible version for all three books. And they're all available through audible.com or Amazon can supply them. And we just finished Strong Medicine a month or so ago. And the narrator of Strong Medicine is an absolutely wonderful guy by the name of Doug McKechnie, who is an actor, and he portrays the characters in Strong Medicine in an absolutely wonderful way. I can't tell you how pleased I am with the work that he's done. And then To Tell the Truth was also just finished a few months ago by Laura Mooney, who is the narrator. And Double Blind, Double Cross had an Audible version available a couple of years ago. So all three are available on Audible, electronic, or paperback.
Yes, there is a growing audience for Audible, and I think I'm going to be one of them, because although I love the holding the book, my eyesight is not as good as it was, and it's just great to plug in the Audible and hear it.
Well, it's a going thing. I think there are more and more Audible listeners, especially with the aging population that we have. A lot of people are having visual difficulty. I know I like the electronic books now because I can enlarge the print and on a Kindle version. But Audible is also good, and there are a lot of people who commute, or at least there used to be. I think that will pick up as we move along, and so I think Audible is an option that's going to be very popular.
And you up until writing, becoming a novelist, you were writing technical.
Yeah. Yes, I wrote, or I edited this textbook, and it's now in its fourth edition by another group of editors who are doing a terrific job with it. And it's been very, very popular in the field of child abuse pediatrics. And I'm sorry.
No, that it must be used in medical schools.
Yes, and residency programs as well.
Yes, and so I would think it would be what's remarkable is you're so able to write dialogue that is colloquial, that is easy to read, and now you have a nice insight into characterization. So, but that obviously comes with work. It doesn't just happen on the first draft.
Well, that's for sure. And someone asked me, how do I do the dialogue? They liked it, and they said they couldn't understand how I was able to do the dialogue. And I said, well, I spent my entire life listening to patients, and so I've begun to pick up the way people speak. Yes. And that's the way dialogue is one of the easier things for the writing from my standpoint. And I have enjoyed doing it. It's been a real journey from writing technical things to getting into fiction. But I thought that fiction is a better way. The story of a situation is often more appealing than dry technical writing that most people don't read anyhow. But I think a lot of people like a good story, and they like a message in that story.
Yes, I would say too that in the history of literature, it has been the social novel that has brought about remarkable change, because the story is compelling. We see human suffering, and it's not just an abstract issue. So I think the three of your books do have at the heart a social problem that needs to be corrected, and yet and at the same time they are good stories and compelling stories. So I hope you're going to continue to write. I don't know whether you are thinking of another novel, but
Yeah, well, I am, but I'm just at the early stages of it, and it's not going to be anything like either the other three. It's going to be more of a historical biography, and
interesting.
it's going to be a departure. It's going to be another experiment with writing that I've never done before.
Yes, yes. Well, I want to thank you so much for talking to us about strong medicine and about and making us helping us become aware of what's happening with the pharmaceutical industry. And I wish you lots of luck with your endeavor. And thank you again for being with us.
And thank you for having me very much. I appreciate it.
Yes. Thank you for joining us, and I look forward to seeing viewers next time on Conversations with Barbara.